This is something you don't necessarily hear every day. There's this giant inflatable colon up at the Salud Family Health Clinic in Longmont today. It's there thanks to Butt Savers, which is a nonprofit which offers low-cost colonoscopies for low-income, uninsured patients. And joining me now from Longmont is Dr. Hans Elzinga, a family practice physician who organized the Butt Savers program. I see a little bit of that colon behind you. It's so funny because all of this is like, very cheeky. You're standing in front of this like huge inflatable colon. I love the name Butt Savers, but this is all pretty serious stuff. Can you tell us about the program, doctor?
Sure. Yeah, so we have a program here in Longmont, which is for low-income uninsured patients to get them life-saving colonoscopies. Yeah, colon cancer is a serious thing. This is actually being done during Colon Cancer Awareness Month to help to improve people's understanding and recognition that, colon cancer is extremely important, extremely common, but it's also very preventable, and we want to really encourage people to get testing done. So that's what we're here today doing, in front of a giant life-size, well, way bigger than life-size, inflatable walk-through colon.
So who specifically is it affected by colon cancer? Who needs to be getting these colonoscopies right now?
So one of the things that we're really trying to highlight, our event is called Butt Savers at 45. That's because the screening recommendations have gone down in the last several years to 45 years old from 50. And that's because there's been a huge increase in the number of colon cancer cases in younger people. So that's increased about 15% over just 10 years in people 40 to 50 years old. And it's increasing right now by 2.5% per year. So we really want to encourage younger people to get this procedure. We've only screened about 20% of that 45 to 50-year-old age group. So we're missing a ton of people. We really want people to know that it's important to get screened.
Yeah, I think that's much younger than a lot of people think, so thank you for pointing that out. Before, we definitely need to see you walk through this giant inflatable colon, but first, can you just tell us what are some of the symptoms folks should be looking out for?
Yeah, and that's really important because screening at 45 is for people who are not having any symptoms. They're asymptomatic. We want all of those people to get screened, but we really want to screen those people too who are having symptoms even if they're at a younger age. So if they have symptoms like rectal bleeding, if they have problems with abdominal pain, if they have unexplained weight loss or a change in bowel habit like new diarrhea, constipation, change in bowel habit where the stool's much more narrow, we want them to get screened even earlier because we see cases now in people who don't even have a family history when they're in their 20s, 30s. So if people have those symptoms, we want them to get seen by their healthcare provider and get testing done.
Makes sense. Please just take a little walk so we can see what's inside.
All right, I'll try to do this so that you can see. So here's the giant colon. Everybody's trying to get out of the way. And I'm gonna see if I can show here. They've even got evidence or examples of colon cancer.
Oh, wow.
And polyps. And then this is actually the entrance to our clinic, so everybody who's coming through today is getting to see this. But yeah, it's about 10 feet high, 12 feet wide, 12 feet long. And you can see here it's also advanced cancer. And then they have over here malignant polyps. So this is actually, we were really fortunate to have folks bring this up all the way from Colorado Springs from the American Cancer Society to help us with this because this is a big deal to try and get the word out. And yeah, something like a prop, like a giant walk-through inflatable colon, it gets the job done for sure.
Whatever it takes, you guys know exactly what you're doing, and you're doing incredible work. So thank you for that, and thank you for spending some time with us here this afternoon. Dr. Elzinga with Butt Savers, we appreciate you.